Hi everyone, my name is Nidhi Sharma. I am a women's health physical therapist. I typically work with pregnant women before, during, and after pregnancy. I also work with a lot of pelvic pain patients who have interstitial cystitis, endometriosis, and all kinds of conditions. This module, these 7-8 modules are for patients. I know a lot of practitioners are here listening to this. You're welcome to listen. We have a series of module coming up for practitioners as well, for trainers and yoga practitioners, physical therapists who are in orthopedics and want to be better known for the pelvic floor health. So today the topic is urinary incontinence, and I'm going to share my screen here. Okay. All right. So urinary incontinence or leaking during pregnancy. First of all, what is urinary incontinence? Basically, simply, it's an incident. It's an involuntary leakage of urine, or when the person urinates when they do not want to. Right, so it can be a small amount, it can be a big amount. Both count as urinary incontinence. Does not have to be daily, does not have to be big. It can be very occasional, it can be very regular. They all count in the same category and have usually the same mechanics or problem behind it. Usually it happens with coughing, sneezing, strenuous activity, and this is specific to pregnancy. In pregnancy, it happens with what we call as stress urinary incontinence. There are other kinds of leaking that happens during different times in life. But in pregnancy, it happens usually with coughing, sneezing, picking up something heavy, running, jumping, different kinds of activities, where basically there's more pressure coming down into your pelvic floor. So this slide is here because not a lot of people think that this is common. Not a lot of people think that they need to worry about it. If they haven't had leaking in past, or they don't know anyone who has leaking, that it's not important for them to know. 50% women during first time pregnancy will start leaking by week 30, okay? And it's very relevant for me because I'm approaching week 30 right now. So 50% women will start leaking around week 30. And if you look at this third graph here, after childbirth, so we're talking about 3 months after childbirth, 50% women are still leaking. They're not the same women, could be different, but they are still, 50% women are still leaking after giving birth. This is vaginal birth. When we talk about second pregnancy, this number goes up to 80%. And consecutively in third or fourth pregnancy, the number keeps going up. So the point is that it's extremely common. If you don't have it, you still need to prepare for it or be aware of it. This is a little bit different graph, and this is the main point of this graph is this number here, which is the long term. This long term was 3 to 5 years. And you can see the people who were leaking short term, 3 months after giving birth, 90% of them, or 85 to 90% of them, were still leaking in long term, okay? So problem does not automatically go away. Another point here is the cesarean people who had cesarean section, who had planned cesarean section, meaning they did not undergo any labor, they did not push, they had no trauma to their pelvic floor whatsoever. 30% of them were still leaking, and in long term, 15% of them kept leaking. So cesarean is not protective of urinary incontinence, one point. And second, this is planned cesarean. If you go through, most of the time you go through labor and then it ends up being a cesarean because of something happening during labor. So that would be even higher. Myths. It's a myth that it's normal and it cannot be changed. So it's not normal. It can be changed. It can be helped. It's not temporary. It usually, like you said, like I showed you, it does go away by itself to some extent right after birth. But if you're incontinent, if you're leaking 3 to 4 months after giving birth, the chances are that you will be leaking years or 3 to 5 years later. Another one is this is due to the weight of the baby on bladder. And I talked about this in on my Instagram yesterday. Baby isn't going to push on your bladder until much later. Okay, so when the baby drops into the pelvis is usually when baby starts to push on the bladder. And that typically is around 34, 36 weeks. At 30 weeks, unless you have gained too much weight or the baby is very big, usually the baby is not pushing on the bladder, and it's not the weight of the baby that's making you leak. You can just do Kegels. Yes, you can do Kegels and they're effective. However, most women do their Kegels wrong. So if you have never been checked, the chances are that you're doing them wrong. Second, it's not just about Kegels. Incontinence has a lot to do with your core. It has a lot to do with your posture. It has a lot to do with your movement. And we'll go over all who have leaking. They think that it's normal, it's going to go away. Then when it doesn't go away, a year or 2 years after that, they kind of feel like, oh, we need surgery because it didn't go away. So surgery is not an easy fix. Even if you need surgery, even if you do surgery, you still need to do Kegels to ensure that the surgery is successful. It won't get worse. A lot of women who are in their 20s or 30s give birth, they're leaking a little bit. They're leaking like a drop every now and then, and they think that is okay, it's manageable. Or they stop running because running is the only time they leak. And then 10 years go by, they're leaking a little bit more. Then 20 years go by and the menopause comes around, and now they're leaking a lot suddenly. So typically around menopause, when the hormones change again, your leaking can get worse. Okay, usually will get worse if you had leaking all your life. So the point is, it will usually not get better by itself, and it can get worse. And last one I already covered, cesarean does not prevent leaking. All right, so pelvic floor. We're looking at pelvic floor today. If you haven't seen pelvic floor before, then this is a nice picture here. This is the pelvis on the right side, pelvis on the left side. This is the bone in the back, and there is a big muscle inside the pelvis, right? And that muscle inside the pelvis is called pelvic floor. You can see that these three openings inside the pelvic floor. This is the urethral opening where you pee from, your vaginal opening, anal opening where you poop from. All these three openings are openings in your pelvic floor. When you contract this pelvic floor, it closes these openings. When you relax this pelvic floor, it opens these openings. So whether it's leaking pee or leaking poop, they're both, or leaking gas, they're both problems of pelvic floor. And we're going to talk about more of how that happens. This is a big picture view. This doesn't show all the pelvic floor, but it shows one of the important muscles. And you can see how it kind of looks like a sling from front to back inside the body. So what happens during pregnancy? Why is pregnancy so important? This is your pelvis or pelvic floor without being pregnant. And you can see we're cutting through the middle of the body, and we're looking inside. This is the backbone here. This is the front of the body. This is where the belly would be. This is bladder. This is uterus where the baby is. Rectum where your poop collects. And you can see this big sling at the bottom, right? That sling-like muscle is your pelvic floor. And you can see how that pelvic floor, when it contracts, will basically support all these organs and close these tubes coming through these organs. So it will help you close those openings. And I've marked this yellow here because that kind of shows what happens during pregnancy. Your pelvic floor stretches and stretches and stretches. It keeps giving in under the effect of hormones and your weight. And now this muscle is stretched out. So if you had a rubber band that you pull and it's nice and taut, it can create some pressure, it can create some tension. And now that rubber band is so loose that you have to pull it a lot more to create the same amount of tension. So this stretching of pelvic floor is one of the reasons, and it really starts happening a lot in the second and third trimester because the pelvis starts to get bigger. And then the baby's weight is, again, growing very quickly. And it's not that the baby is pushing directly on the bladder, but it is that the baby's weight now, even though it's not on the bladder, it is going to indirectly go through the pelvic floor. So pelvic floor has to take a lot more weight, and it basically gives into that weight by stretching out, making space. And you can see that yellow line here that I've made for that pregnant belly. So I'm going to explain briefly how you hold your pee, and then I'll show you how the pelvic floor does it. This is the bladder. Bladder is a big bag, okay? It's a big bag of muscle. This muscle you cannot control. It's not under your control. It fills up with urine, and as it fills up with urine, it stretches out. Pelvic floor is another muscle. This muscle is in your control. You can contract and relax it. And there are two kinds of muscles in the pelvic floor. You can see one is this long sort of flat muscle, and then there's this knotty muscle in the middle that kind of wraps around the tube, and this tube would be urethra, where you pee from. So what happens normally is your bladder fills up. When it fills up, the pressure increases inside the bladder. If the pressure was not managed, the pee would come out. So what happens is the pelvic floor contracts and creates the pressure inside this tube to keep the urine in. When your bladder is full and you're ready to pee, the pelvic floor relaxes, the bladder contracts, and you pee. Now, what happens when you leak? When you leak, even though the bladder is not contracting, bladder isn't full, it's not contracting, you're not wanting to pee right now, but something else creates an extra pressure on the bladder from the top, okay? And this could be you coughing, this could be you jumping, this could be you sneezing, something that makes all your organs and your body weight go down into the bladder. And now this extra pressure is there. So what needs to happen is the pelvic floor needs to contract extra strong to hold that pee in. It has to increase the pressure even more. And if the pelvic floor cannot do that, then the pee comes out. So it's really the game of pressure. Pressure inside the bladder and pressure outside the bladder, or pressure in the urethra. So you can see how this downward pressure on the bladder is going to create a problem. So what will the pelvic floor do is the flat part of the pelvic floor, you know, that looks like a floor, is going to create an upward pressure so that it lifts the bladder up, okay? So that upward pressure is one thing that's important. And then the small muscles around the urethra are going to squeeze the tube to keep it in. So both parts of the pelvic floor need to work. One part that lifts, the flat part, this one, and one part that squeezes, that closes. And these are important because when we go into cueing, I'm going to tell you the cue for squeeze, we're going to tell you the cue for lift, and both are important because both will help you hold your pee. The other thing I'm going to quickly mention here is, one other thing is more pressure coming down into the bladder, more chances of leaking, right? So that's one of the reasons you are leaking, because now there's the weight, you're increasing body weight. If you gain more weight than your doctor wants you to, okay, in obesity, if you are lifting something very heavy, you have weight in your hand, all of those things are increasing the weight that will go through the bladder, right? So if you're going to lift something very heavy, maybe you need to lift it in 2 pieces, okay? And obviously weight management, making sure you're gaining the right amount of weight. Gaining too much weight in the second trimester can also predispose you to leaking. Okay, this is a quick ultrasound here. You can see this is the bladder, the big black bag will be the bladder, and this white sheet underneath will be your pelvic floor. This ultrasound is not of a pregnant woman, so it looks different. This black stripe here is the vaginal stripe, and you can see when you are coughing, the bladder gets pushed down, right? And if the pelvic floor does not fight and pull it up, the bladder will come down. And the second time, when she coughs, and the pelvic floor engages, the bladder moves a little bit, but does not come down as much. And that's what we want. All right. Okay, so let's talk about Kegels for a minute. So this is your pelvis, okay? Bone on the left, bone on the right, bone in the back, tailbone here, okay? Inside, bladder, uterus, rectum in the back. Again, not a pregnant uterus, so looks different. When I take these organs out, this is the pelvic floor inside, okay? Looks like a big basket. I'm going to show you from the side. You can see how it really does look like a basket from the back to the front. This is the front, this is the back, okay? So this basket-like muscle, when it contracts, it lifts up, okay? It lifts the bladder up. So it's, you're going to think about, or when you engage the pelvic floor, you're going to think about this, a basket going up. And then there are muscles that are close to the urethral opening here, okay? These tiny small muscles, not all of them are shown, some of them are inside. The sphincter muscles are tiny muscles. So if you think about really squeezing or holding your pee, you often get these squeezing muscles to work. The squeezing muscles are smaller, okay? So they will help you hold your pee, maybe not that long though. And they will definitely not be able to fight the big pressure that's coming from the baby or the weight or the cough. It will help you a little bit until you get to the bathroom. It won't help you 40 minutes of a train ride. What will help you that time is that big bulky muscle inside. That's the meat of pelvic floor. So when you do Kegels, if you're thinking about squeezing, you're probably getting the smaller muscles to engage, which is not wrong. But we want you to get the bigger muscles to engage because the bigger muscles have a higher chance of success for you, especially when you have stress incontinence, when the pressure is causing you to leak. So that's why I said lift is more important than squeeze, okay? The cues usually get you to do both. And we're gonna talk about those cues in a minute. Cues get you to do both, but if you're going to think about one, I want you to think about lift, usually. All right, so best cues. You're sitting and you think there's a tampon inside your vagina and you're trying to pull that tampon in. So if the tampon was too small or too loose and it was falling out, okay, so you're gonna think about pulling it in. So two things happen. If this is the vaginal opening and you think about pulling the tampon in, one, you have to grab the tampon, right, before pulling it in. So that grabbing gets you to do the squeeze, and then pulling gets you to do the lift. Okay, so squeeze and lift, and you can try this now. Pull your tampon inside your body. And what you should feel is around your anal opening, around your vaginal opening, there is a movement or feeling of movement going up or going inside your body. You may also feel that your abdominals, your abs engage a little bit, which is totally fine. Your abs can engage, but your glutes should not be engaging. You should not be squeezing your butt. You should not be squeezing your inner thigh. Try to keep your legs and your hips quiet. You might feel that your abs engage, and that's totally fine. These are best cues for the population. These are not the best cues for you. Ideally, when I see the patient, I do an internal exam. I feel their pelvic floor and see which one is the best cue for them. So here I'm going to give you all the cues and you're going to try all of them and see which one makes most sense to you. Pick up a bean from the floor using your vaginal opening. And this usually works if you're sitting. So if you're sitting in a chair, kind of sit forward. Okay, and sit forward so your vaginal opening is touching the floor, the surface that you're sitting on. And then think about there's something under your vaginal opening, a bean, that you're trying to lift up, that you're trying to pick up. And that picking up, again, to pick up, you have to first grab, so you'll get some squeeze, but then your focus will be up, lifting up. Holding your gas by closing your rectum and pulling it to the pubic bone. If you've done yoga or mula bandha, you might know this one. So you're thinking about squeezing the back end, so holding your gas, okay? And then where you feel that motion, close to your tailbone, think about pulling that tailbone or rectum to the front of your pelvis. So wait, where is this? Yep. So contract here in the back and then think about pulling to the front. So from back to front, it kind of feels like a line and both openings engage to go up. Imagine the inside of a pelvis as an elevator and think of riding up that elevator. That's another famous one that works for most women. You have, I'm gonna go back for a second. Right, so this floor, right? If you imagine this floor inside your body, it kind of looks like a floor, right? So if you were standing on this elevator floor and you're going up, so think about there's a floor inside your pelvis and you're going to think about lifting that floor up to go to first floor, second floor, third floor, and then slowly come down to second floor, first floor. Okay, and that control of going slowly 1, 2 and coming back to 1, 0 is important. So don't just go all the way up or all the way down, go slow. Imagine a wire connecting your anus to your pubic bone and slowly pull this wire. So you're opening where you pee from, opening where you poop from. Imagine there's a line there, there's a wire there, and you're trying to pull the wire from the middle. You're trying to create a kink, okay? So you can think about pulling both of them and going up, and if that's too much, you can think about a wire in between and basically kinking that wire in the middle. You'll get to engage both. Pick up 2 blueberries. This is a hard one for most people. Pick up 2 blueberries, one in the anus, one in the vagina, and then without crushing them. That's tough. But that again gets you to engage both. You don't usually have to isolate the back end or the front end, right? You're gonna work both ends. Pelvic floor is one big muscle. You cannot isolate just the pee part or just the poop part. You can bias a little bit, and I'll tell you in a little bit how you can bias it to the back end, to the leaking gas versus leaking pee. And I'm going to go over leaking pee because that's what the presentation is about, but you can bias these movements a little bit, but no matter what you do, you're going to feel both hands, and that's totally fine. You're going to feel both hands, you're going to feel abs, and that's fine. Just don't squeeze your buttock. Okay, breath and pelvic floor. So breath and pelvic floor is very important, and that's the reason I'm bringing it here. It really shouldn't be said breath, it should be core and pelvic floor, because breathing and pelvic floor are inherently related. They work with each other, they drive each other. And if you're holding your breath, which I see a lot of women do their Kegels like this, okay? If you're trying to hold your breath and you're really trying to squeeze your pelvic floor, you're not gonna get very far. Even if you can squeeze it, it's not gonna lead you necessarily to higher function in life, because in life, you're not holding your breath, you are breathing, right? So this muscle up top that you see, the pink one, is your diaphragm, the muscle that you breathe in and out from. So it's right under your rib cage. Get up. It's right under your rib cage here, okay? And then the pelvic floor is down here. I don't think you can see, but like I'm gonna show you up here, but it's like down here. So pelvic, diaphragm and pelvic floor. When you breathe in, the diaphragm goes down, the pelvic floor gives in a little. When you breathe out, the diaphragm goes up and pelvic floor sort of swings back up or springs back up. And that's the animation you can see here, right? Both going up, both going down. And that nice motion is natural to body. It's not like they only can go this way, they cannot go the opposite way. They can, but this is nice, easy motion that happens with every breath. And with this motion, the reason I'm telling you this is, if you can put the breath into this cycle of Kegels, your Kegels will be more efficient, okay? So when you breathe in, your belly gets bigger, you can see this, and the pelvic floor relaxes. So breathing in, belly relax, pelvic floor relax. Breathing out, belly contracts, pelvic floor contracts. Even if you don't contract the belly, it's going to contract automatically if you're contracting your pelvic floor. Okay, so breathing in, relax, relax. Breathing out, contract, contract. And that's the cycle you're going to start practicing, not because this is the only cycle that happens, but because if you practice in this cycle, it'll be easier for you to feel it and get stronger with it, right? So here we go. I'm going to do this here, and I am also engaging the abs, and I show this picture in pretty much all the modules because this is one of those central piece of activating core. And when I say activating core, I mean all three of those muscles: your diaphragm, breathing muscle, your pelvic floor, and your abs, your deep abs. So I don't like to teach one without the other, so I'm going to teach you all three together. So if you've seen the older modules, you already know this one. You're going to breathe in. So I'm going to breathe in first into my belly. So it's not like I have to blow up my belly, but quietly breathe into your belly. Let your belly get big. And as I breathe out, so when I breathe in, what was it? Relax, relax. So everything relax. Breathe. When I breathe in, I relax my belly. I relax my pelvic floor, or don't do anything with my pelvic floor. When I breathe out, I'm going to breathe out like I'm blowing a candle. So, and then at the same time, I'm going to think about pulling the sides of my pelvis together. You can skip this part if this is too much, but you're going to think about pulling your tampon in, or think about holding the blueberry, or think about riding up the elevator. Whatever cue you like from that other slide is the cue you're going to think. I wrote tampon here because that's the cue that works for me. All right, here we go. Breathing into the belly. Breathing out from my mouth, pulling the sides together. And when I breathe out from my mouth, I think about pulling up the tampon, okay? And when I think about pulling up the tampon, automatically squeeze will happen. 90% of the time, or even more, when you're lifting, squeeze will come. But if you're squeezing, lift may or may not come. So I want you to think about lifting. All right, so now let's talk about posture and Kegels. Posture and Kegels is a very long drawn topic, and it's not really necessarily even a constant. Different women show different tendency with posture, okay? So what I'm teaching here isn't something that will always happen, but this we see in clinic happens more often than not. Okay, so if you're standing, this is me, I think I'm 24 weeks pregnant, and I'm standing just with the weight in my arches. Okay, then I lean forward a little. I don't change my posture. I just sort of lean from my ankle a little bit, like a ski jump, and my weight is in my toes a little more, or the ball of my toes. Then I lean back again, and now the weight is in my heels more. If you are doing Kegel, and you can do this now, stand up and do a Kegel. Stand with your feet flat, do a Kegel, see how you feel, where you feel it. Okay, now shift your weight forward and do a Kegel and see where you feel it. And now shift your weight back and do a Kegel, see how you feel it. Usually, not always, in this position, you feel it more in the front, okay? So you feel like your abs contract and you feel like the opening near your vagina and your urethra close. When you stand in the heel and do it, you feel more towards your back end. So you feel like your glutes and your pelvic floor towards your, anal opening engages, and the front less, okay? So pelvic floor is a weight-bearing muscle. Wherever you put more weight, likely it will engage there. So if the weight is more in the front, it will engage more in the front. Weight is more in the back, it will engage more in the back. If the weight is equally distributed, it will likely work equally. The important reason I'm telling you this is, I see this is the common posture, not with the toes up, but sort of standing in your heels. If you're very pregnant, you can stand right now and see. When you stand, is your weight all on your heels, and you kind of arch back. So you stand, I don't know if I can see, and you're arched back like this. So if you're arched back and your weight is in your heels, it's hard for you to engage the front part. It's hard for you to engage the part that closes the vagina and the urethra. So you might have to change your posture a little bit, and that might be one thing where you leak, because you keep walking with your lean in your back, right, and the weight in your heels, and you're trying to do Kegel, or when you cough or sneeze, your pelvic floor doesn't have much of a chance, or as much of a chance, if your weight is so far in the back. So bring that weight forward. If you have seen the last presentation, I taught you, first thing we did in correcting posture was to really correct where your weight is. Soften your knees, bring your weight forward. If you haven't seen that, go back and see that, and you can see the middle posture is where I would want you to be. Sometimes if you're having a very hard time feeling your pelvic floor, you can even go shift even forward into your toes or ball of your feet a little bit, and you'll feel the front part engage a little bit more. The simple science here is wherever you put the weight is where the pelvic floor is going to engage. So put the weight, don't keep the weight all the way in the back, okay? And it's also it's not just the common posture for pregnant women, it's also common posture for moms, because they hold their baby on their pelvis and they kind of lean back. It's easy to lean back and just hold the baby on your belly, and that's going to take away that alignment which was enabling the front part of pelvic floor to engage. Sitting posture, when you practice, so the reason I told you this is I want you to practice Kegels in standing position. Okay, you should practice Kegels in all different positions: lying down, sitting, standing, walking. So when you're doing it in standing position, washing dishes, or just, you know, around the house, don't be on the first position. Try to be in the second, or if you need, be in the third position to try. If you're practicing it sitting, in sitting you can't really shift your weight that much, but your pelvis can tilt forward and back. So if the pelvis tilts too far back, if the pelvis is sitting like this, if it tilts too far back, what's going to engage? The back part, right? Because that's what's taking the weight. If it tilts too far forward, you might get the front a little bit, but if you're pregnant, it's unlikely that you can get that far forward. So when you're sitting, the best part is to be in the middle. So you're going to go around your back all the way, arch your back all the way, do that a few times, and then whatever feels like 50% to you, stop there. And that's probably the point where you're going to do your Kegels. It should feel like you're sitting on your vaginal opening. Okay, you should not be on your tailbone. You're not going to be any further forward than vaginal opening, especially if you're pregnant, but you should feel either in the back part of your vaginal opening or actually on your vaginal opening. Okay, so this would be the ideal position. So I round my back, arch my back, and then I stop, round my back. And then I'm going to stop somewhere in the middle, what feels middle to me, and my vaginal opening is touching the surface. That's the position I'm going to do my Kegels in. Okay, also, pelvic floor is a muscle that's like biceps, right? If you were training your biceps, sometimes you're going to pick something up. Sometimes you're going to put something down. Sometimes you're going to put something down very slowly. Sometimes you're going to catch something. Sometimes you're going to throw something. So there's so many different ways that you use your biceps, right? You don't just do curls, you do so many other things. And that's true for pelvic floor. You don't just keep doing Kegels in one place. That doesn't get you very far. That's a good starting point to know pelvic floor and start working on the pelvic floor. But very often I see that women either contract or relax, and that's all they do. So these are 4 easy things to play around with. Contract as strong as possible for 5 seconds, okay? And then hold for 5 seconds and then relax. That's 1. That's the slow contraction and relaxation. 2, contract as strong as possible and then quickly relax. These are quick flicks. Okay, so this trains coordination. You're going to go contract, relax, contract, relax, contract, relax. Third, contract quickly and then slowly relax, almost like you went to the third floor on the elevator quickly, and now you're coming down slowly. And then you can reverse it. You're going up slowly, but then you basically fall down. Okay, so play around with pelvic floor contractions. Whatever feels the hardest probably is the thing that you need to work on the most. You need to engage variety. You need to bring variety to pelvic floor muscles, because that's how they work. Sometimes do it sitting, sometimes do it standing, sometimes do it lying down, sometimes do it walking, sometimes do it strong, sometimes do it slow. Do it every time you work out. Doesn't matter what kind of workout you do, whether you do yoga or you do Pilates or something you're doing it for pregnancy. If you don't do any workout, well, you should, but if you're not, then you can do just Kegels during daily life, right? But if you are doing squats, you can do Kegel when you come up. Basically every phase of the exercise where you're breathing out is when you can do the Kegel. And that really is the thing that helps. Doing Kegel lying down in the bed is not as useful to you when you leak, sneezing, or lifting up your baby, right? So really, if you're leaking, lifting up your baby, you have to practice Kegel in that position of lifting up your baby. So you have to bend over, contract, and then lift up and practice that. And that's why, even if you're not leaking, hopefully you're not leaking right now, in pregnancy, I want you to practice this throughout your exercise routines. Every time you exhale, contract. Make sure you inhale and relax. I am not saying keep your pelvic floor contracted all the time. I am saying contract and relax. Practice both cycles, but bring it into your daily life, bring it into your routine so you're used to it. And I'm going to talk about this quickly here. Pelvic floor synergists. So you will see a lot of programs where they're teaching you pelvic floor exercises, or strengthening your pelvic floor, or decreasing the leaking. And there are a lot of exercises for inner thigh or outer thigh or abs. None of those exercises are bad. The muscles around your hips do help your pelvic floor. Okay, and I'm going to show you a couple of them that can help your pelvic floor. Important thing to know is that you should know how to do Kegel. You should try to do Kegel. If both of those aren't enough for you to stop leaking, then you can add the helpers, right? So helpers should be helpers. They should not be the main guys. The problem happens when you are doing all of that inner thigh work and outer thigh work and you're not leaking, but your pelvic floor isn't working. Your pelvic floor isn't doing what it needs to do, right? And then 34 weeks, you're still leaking again. So don't get into those programs. We're not building the base for you to engage the pelvic floor, and are just teaching you all these other things that can help muscles should only be helping. Okay, so when do you do it? You can do it anytime, really, as long as you're doing Kegels. You can engage these muscles as well in your routine workout. You should be doing it if you're pregnant and leaking in like 34, 36 weeks. At that time, you do need help, right? So if the baby is actually pushing on the bladder and you're leaking all the time and you're very big and you can't do a lot, then you can use these helpers for the time being. You can also use this if you're not making enough progress, to see if you can get a little help, or if you're unable to feel the pelvic floor contraction. When you do these exercises and in your brain you think about the tampon or the elevator, while you do these exercises, engage these muscles, but think about the elevator. Sometimes you can feel that elevator a little bit more. Okay, so basically they can help you feel it, they can help you strengthen it, they can help you get there. And that's what the point is, right? So inner thigh muscles, buttocks, and sometimes abdominals. Now abdominals I already talked about. So if you're engaging pulling the sides together, that part, if you keep doing it, right? If you're not getting a lot from your Kegels, but when you breathe out, you think about pulling the sides together, making your waist narrower, eventually you'll be able to get a little bit more of the Kegel effect. Okay, there is no reason to isolate breath, abdominals, and Kegels. They work together. They're a team. There is sometimes a need to isolate the hip muscles from the pelvic floor muscles. All right, so this is the inner thigh. A yoga block between your knees. You're going to breathe in to your belly, same way. Breathe out from your mouth, and you're going to squeeze the yoga block. At the same time, think about pulling the pelvic floor or pulling the tampon in, or whatever your cue is. If that doesn't work, or if it works but it's easy, you can add a bridge, and bridge will help your buttocks, and again that's also helps. So buttock kind of helps the back end, and inner thigh helps the front end, and both of those help together. You may be able to feel the pelvic floor a little bit more. You can do one of them. There are two exercises, squeezing and lifting. You can do them separately. I'm doing them together. Okay, then this is another version. Sorry, chair pose, right? Yeah. So if you are somebody who likes to yoga, this is the easier one. Yoga block between your knees. You're gonna squeeze the yoga block. Make sure your back is not super rounded or super arched. Okay, and you're gonna get into a chair pose. Squeeze. Breathe in, and as you breathe out, you're gonna come up. Yep, you're gonna come up and do a Kegel. So as you're coming up, you exhale and do a Kegel. And there's no rule. If you feel like going down is when you feel like you leak, you can exhale and go down and squeeze, okay? So whichever phase you feel like is the harder one is where you're gonna put that exhale and engaging the pelvic floor. Make sure you relax. Do not get overzealous and hold your pelvic floor all the time. That does a lot of harm, okay? So make sure you're relaxing every time you're relaxing. If you are contracting and relaxing in a good cycle, usually by 5 to 10 repetitions of pelvic floor, you're tired. All right. So again, like I said in the last one, this is a good overview. You can prevent things, hopefully. If you have a little bit of them, you can start to help yourself. But great progress, if you already have leaking, great progress is made when you actually come to physical therapy. Two reasons for that is I can show you models and I can tell you all these things. When we do an internal exam, you can feel the muscles engage, and there's nothing that compares to that. If you don't like an internal exam, I can do an ultrasound. I showed you an ultrasound video earlier where you can see your pelvic floor. So that ultrasound head kind of goes on your belly like your pregnancy ultrasounds. And then I can show you, okay, this is your pelvic floor. Now try this cue, try this cue, try this cue, see what happens. It goes up and down and you can actually see it. We can also put a sensor inside the vaginal opening or anal opening. It looks like a plastic sensor. It goes inside the opening and it basically senses the activity of that muscle on the inside and shows you a graph on a computer. So when you contract, it goes up. When you relax, it goes down. And then that gives you an objective, more or less objective number of how strong you are and how you're doing. So especially for pelvic floor rehab, for urinary incontinence, there's gold standard is pelvic floor physical therapy, because we can really see and help you feel and help you see what's changing. I think that's it.
Can you hear me?
Yes, now I can.
All right. Okay, so I'm going to ask you questions.
Can you increase the volume? Wait, I can increase the volume probably. I can't hear you. Okay,
ready?
Go ahead.
So first question is, can Kegel exercises help improve incontinence in geriatric population as well?
Yes. In fact, I said earlier, these things get worse as you get older because of the hormonal changes. So it is quite common around menopause for this problem to start, and it's very successful. If you do pelvic floor rehab properly, it is very successful in helping these issues.
Great. And also during pregnancy, it's important to do like consistently doing the Kegel exercises during the pregnancy and after. But when would you recommend to start actually doing these exercises?
Like throughout. Oh, when should you
Throughout.
start, you mean?
Right.
So good place to start is usually in second trimester. You know, I'd like to say first trimester, but I was too sick to work out. So second trimester is probably the time that the pelvis is loosening, you're starting to feel some changes. And you're not big yet, so you can still do most of the workouts that you want to do. As soon as you start to work out anytime in pregnancy, you should start to connect with that pelvic floor.
Do you think you should start even before getting pregnant?
Yeah, I mean, everyone should have an knowledge about their pelvic floor and how to engage the pelvic floor. The reason is that I'm not asking everyone to engage all the time. You should know about your pelvic floor and how it works with your breath. But ideally, if you're breathing properly and your alignment is good and your posture is good, then pelvic floor will come along for a ride, will work. You shouldn't have to think about engaging your quadriceps. You just do squats, right? So if you're in a good alignment and you're connected with your pelvic floor, you should connect with your breath and your posture is good, your pelvic floor will work automatically. In pregnancy, it becomes important to think about it because your posture is changing and your pelvic floor is stretching out. So now it may not be as automatic as it used to be.
Okay.
And women who leak before pregnancy are highly likely to leak during pregnancy. So if you had occasional leak here and there before pregnancy, it's very, very important to sort that out before getting pregnant, if you can.
That's a good advice. The next question. So as a PT, we prescribe exercises to patients so that they can perform at home. How can we encourage them to perform exercises? So
Kegels or generally exercises?
I think it's in general.
So exercise is, this is one of the future modules about, benefits of exercise. Exercise is shown to decrease the chances of so many pregnancy complications, right? Diabetes, preeclampsia, low birth weight, preterm labor. It has even been shown to improve the circulation and have a higher IQ for the babies when they're born. It has been shown to decrease the chances of diabetes and obesity in babies and like when they grow up. So you are in a phase of life where you're changing a lot for yourself, but also for your baby. You're giving all these hormones and effects and habits. So hopefully that's a good motivation to do. Like most moms care a lot about their babies.
Great. This person has read something online, I guess, that the tightness in the pelvic floor can also cause incontinence. So is doing Kegel exercises in that case be safe?
No, it won't be. Okay. So, and I've said this a lot of times in past also, you should get diagnosed of why you're leaking before you start doing Kegels. I'm a little less apprehensive of, I don't tell people to do Kegels if they're leaking by default. I am telling them in pregnancy for two reasons, because the likelihood of them being weak because of stretched out is high, right? Because of hormones and other effects. Second, we can't do a whole lot of other things in pregnancy. We can't do internal work. We cannot change a lot. So in pregnancy, I'm okay having people do Kegel, and really it's to prevent more than to treat. If you have leaking, you should get treatment, you should get assessed, but you should do Kegels to prevent the leaking. If you're not pregnant, especially if you have never been pregnant, the likelihood of you leaking because you're tight more than you're weak is very high. Dancers, swimmers, runners, they leak all the time, and they're not weak, they're tight. So in that case, if a runner asks me, I'm leaking, should I start doing Kegels? I would say no. Get assessed, at least get assessed once to see why you're leaking. So tightness can cause leaking, absolutely. And I explained this in a past video. If you have a bicep that's too tight, right? You have a bicep that's weak, you're going to have to lift weights to strengthen that biceps. But if your biceps is here and it can't even straighten, you can't lift, of course, because you can't even go there. So before strengthening, you're going to have to stretch this biceps. So that's how the Kegels, tight pelvic floor can also cause leaking. It's not that common in pregnant women, but it is quite common in other populations, especially pre-pregnant or non-pregnant women.
So completely relaxing your pelvic floor while you're performing the exercise is going to be very, very important as well.
Depends on if they're tight, if they're poorly coordinated. I mean, and they don't have stress incontinence. What they have is urge incontinence. Usually they have a strong urge to pee and then they leak. So that's a different population and will be treated very differently, and likely cannot be treated without an internal exam because we have to know why they're leaking. Stress incontinence that only happens when you cough or sneeze, or especially during pregnancy, is an easier symptom to basically assess because it comes with the pressure.
So it's recommended to come see.
Yeah, you have to. If you are not, if you've never been pregnant, you're leaking. I can't give you any good guesses. You should get evaluated.
Yep. All right, that's it from me.
All right.
Any other questions?
So the next module will be, I'm trying to look, sorry. So diastasis recti, or separation of abdominals. This is a big one. A lot of women have questions about that and concerns about this. So next week, we're going to talk about why that separation happens, if that separation is a problem, and how to remedy it or how to prevent it maybe. About the professional modules are for basically for trainers, yoga practitioners, fitness practitioners, doulas, birth professionals, or physical therapists, occupational therapists, other therapists who are wanting to work with pelvic floor, with pregnant population, not necessarily doing internal work, but working around that thing and helping them maybe prevent all of those problems from happening. We go in a lot more detail into the anatomy. We go into the detail of, so here I'm showing you, roughly the muscles. There I'm going to show you exactly where it inserts, how it works, the specific parts of the muscles and how you can engage. We go a little bit more into detail of how you're going to manage somebody who is leaking with jumping, or leaking with running, or leaking with lifting something. So there are different activities. Something that I evaluate in my patients, I'll try to generalize that information and teach.
All right, thank you very much.
And
so
it also has 10 modules, I think. And we're going to go over changes in body, physiological changes, anatomical changes. How does walking change? How does posture change? How does balance change? Diastasis, organ prolapse, incontinence, and helping preparing your clients for labor was one of the modules.
Great, and then we might have just a discussion session, like any questions, any concerns, and you can answer it. I think that'll be great for everybody.
Yeah.
All right, thank you very much. And we have the same session at the same time, Wednesday, Eastern Time, New York, 9 p.m. So whatever that you're living in, adjust it to the Eastern Time, New York, Wednesday night, 9 p.m. And we'll see you next time.
June 3rd. Okay.
June 3rd. Yep. Thank you very much.
Thank you, Nidhi.